Hello, I'm Dr. Michael Polcino, and I'm a practicing obstetrician and gynecologist. Today I want to speak about the ectopic pregnancy. Now, an ectopic pregnancy, by definition, means that the pregnancy is outside of the uterus, outside of the womb where it's supposed to be. 90% of the time, it's growing in the fallopian tube, and 2% of all pregnancies will be an ectopic. Let's turn to what are the high risks. Obesity, over 35, a history of a previous ectopic pregnancy, tubal infections, tubal surgery. But remember, 50% of all women who have an ectopic have no risk factors. Diagnosis is hard, and here's what we do. The two things we use to diagnose an ectopic is the transvaginal sonogram and also a blood test called the quantitative HCG. Now, on a transvaginal sonogram, at 4.5 to 6 weeks after the last menstrual period in a person who has irregular cycles, we should see the gestational sac inside the womb. If we don't see it, then we're worried. We start to look outside the womb to see if we see a sac on the tube, on the ovary. Is there a mass? Is there blood? Also helping us will be this quantitative HCG. Quantitative HCG means chorionic gonadotropin. This is a hormone that's made by a pregnancy as soon as it implants, and it's a number that gradually goes up in a regular fashion. If it doesn't go up, then we're worried about an abnormal pregnancy. Now, it should double every 3 days, and it should increase by 50% every 2 days. There's a discriminatory zone, and what that means is if you reach 1500 to 2500, you should see a sac inside the womb. And if you don't, we're worried about ectopic pregnancies. Now, let's turn to treatment. Treatment includes a medical treatment and also a surgical treatment. 70% of the time it's a surgical treatment, 30% it's a medical, but the medical are increasing gradually. The surgical treatment would be a laparoscopic procedure, and we remove the tube or we remove the ectopic from the tube. Now, the medical treatment is methotrexate. It's a chemotherapeutic medication that's used for cancer. It affects rapidly dividing cells, and pregnancy is an area of rapidly dividing cells. Now, the success and failure rate of both of them are exactly the same. So there's a 70 to 80% chance of a normal pregnancy in the future and a 10% chance of an ectopic pregnancy. Lastly, I want to turn to an emergency. If a young woman comes in and she has severe abdominal pain, she's sweaty, her pulse is good, she doesn't look well, and she's pregnant, we worry about a ruptured ectopic pregnancy. A ruptured ectopic pregnancy is bleeding, and that's in a real emergency. We have to get that patient to the operating room. So I hope you learned a little bit about ectopic pregnancies. I'm Dr. Michael Polcino, and as always, I wish you good health.